Hi, my name is Donna Thomson, and I am a caregiver, an author, and an activist in the area of family caregiving and disability. So I'm delighted to be with you today at this conference, Engage 21. And I'd like to pose the question, what does the future hold for people with diverse abilities? And what is the role of the family caregiver in that future? So looking to the future, what do people with diverse abilities actually want? Well, they want the same thing, I think, as all the rest of us. And caregivers want this too for themselves and the people that they love who have diverse abilities. So we all want to be at home, have a home. We want to be social with family and friends. We want to be safe and free from exploitation or neglect or abuse. We want to be supported with both formal and informal care. So we need we need medical care and medical supports, professional supports, but we also need our families and our friends. So, one of these things we tend to overlook sometimes is that we need to have meaning and purpose. And to me, that means the opportunity to contribute in the community and to contribute in the family. So, I think this is one of the caregivers and the community's great challenges is to find ways that people, even with, severe impairments, can contribute. So, what is the role of caregivers moving into the future? Well, caregivers are modeling how to integrate healthcare into daily life at home. We're really the leaders in this. We've been doing it invisibly for a long time in Canada. This is a photograph of my son's bedroom. When he lived at home until the age of 23 when he moved into a medical group home nearby. But for 23 years, we ran what I would describe as a home ICU type setting with a lot of medical supports and 24-hour awake nursing care, much of it that we provided ourselves. Um, but Nicholas, our son, is technologically dependent. And so looking to the future and preparing for this talk today, I really wanted to reflect on technology and how technology fits into this vision of the future. So we are already using a lot of smart technology and AI at home in the lives of people who have diverse abilities. Um, when I think of how technologically dependent Nicholas is, he just has machines everywhere that help him be healthy. And, many of us do. So our homes are filled with technology. And I think the future of technology in care is huge. But we have to be very, very careful, I think, and intentional about the way that we think about and plan for and use technology moving into the future. One of the ways I think that technology and families can work together to create a safe and secure future for people with diverse abilities is to figure out how to bridge the home to the professional medical supports, to the clinic and to the hospital, and to embed the family caregiver into the circle of care formally in those technology solutions. And we need to be co-creators of them as well. So COVID has really actually been very helpful in this regard. All of a sudden, we're having virtual appointments with the doctor. We're able to email the doctor. Many things that sort of the healthcare system writ large said were impossible are suddenly not impossible at all. we can have the healthcare system that we want, that is family friendly and community friendly and home friendly. So we just need to be intentional and we need to demand it. So, but do we want robots to replace people? Are we beginning, to get the impression that robots may be better at caring for people with diverse abilities than we are? I think we need to be very careful moving into this territory. And Waiting for My Robot was the title of an article that a caregiver colleague friend and I were going to write before then the pandemic hit, and we abandoned that project. But I still think it's a good title, and it's something that we need to reflect on an urgent basis, I would say, because people can love, but robots can't. And looking to the future for people we love with diverse abilities, we need to figure out how family caregiving and love in families, in communities, can be a driving force that is sustainable. So, caregivers are leading a new intergenerational idea of community. And, I think that the appetite for this model of coming around and helping each other is going to be even stronger when the pandemic ends. We have a real opportunity to reimagine our neighborhoods now and the way that we care for each other. And that means that doesn't mean going back in time, to like cars are better than horses, but we really need to look at people and how we can sustain the integrity of families, whole families, to care for those of us, who have diverse abilities, who are aging into disability, or people with disabilities who are aging. So I think one of the pillars of making this fundamental change in society to be the democratization of knowledge. Previously, medical care and the skills training to do it was the private domain of medical professionals. And as a family caregiver, I can tell you that my experience was, here's a piece of equipment, that your son needs, like it's a feeding pump, say, bring it home, kind of here's some lessons, but it's so stressful. By the time you get home, you can't remember anything anyway. And all of the responsibility to use it is on the family's shoulders. I feel this is absolutely wrong, not sustainable. We need to give families the training and the skills that they need, and we need to support them while they practice it. And we need to give them the empowerment of having the skills training to the level of competency or even mastery, so that people are comfortable in their role as family caregivers. So this means a new role for universities and other institutions. It means online learning. It's possible through partnerships. It has to be accessible and it has to be free. So this is not about creating another sort of have and have-nots in terms of the training needs of families supporting people with diverse abilities. It has to be free. So an example, a project that I worked on at McMaster, we created 3 courses, family engagement and research as a driver for change in practice and accelerating the speed of impact of research. Also, Caregiving Essentials, a kind of Caregiving 101 course to help people feel comfortable in the role and to build community, a community of caregivers. And also responding to the needs of the pandemic, we realized there was no skills training for infection prevention and control for families that was presented in lay language. It only existed for healthcare professionals, But who delivers 90% of the healthcare in Canada? It's families. So there's now an online free course for caregivers and families in IPAC, infection prevention and control. Another strategy I wanted to present today that can support this new model is personal science. So the relationships in networks of care, or what I would call the ecosystem of care today, are so complex that they're often invisible to us even. Um, so one of the solutions to better understand our ecosystems of care and therefore influence them, plan for uncertain futures, etc., is something called care mapping. And atlasofcaregiving.com is a social enterprise that offers free tools and resources to draw your ecosystem of care and then give you a set of questions to ask yourself about what you see in your care map. And there's a body of evidence that is behind the efficacy of this. And it's something people can do on their own or together with their family or together, with their care providers, social workers, etc. It's a great, great tool for understanding who's who and who's doing what in the circle of care. Another example of how people can come together to better support the sort of people factor of the future of caregiving and the future for people with diversabilities is an example, something called the Caring Collaborative. It's actually a grassroots organization of people who came together on their own to organize themselves to share their resources, share their skills and abilities, to offer each other helpful services when and if people age into disability and or have a sudden diagnosis of a disease, and they can offer each other transportation, companionship, grief support, help with treatment choices, and practical home help. They even figured out how to organize themselves to offer a falls prevention course called Wellness Wednesdays. And now that's being offered online, of course, and they use social media to coordinate and support all of this community caring. So, I guess the last message I'd like to leave you with is that the neighborhood is the unit of change. And starfish are not saved one by one. We need to scoop them all up and save them all. So that's a quote from David Brooks, who writes for the New York Times. He wrote a wonderful article with this title, "The Neighborhood is the Unit of Change." So that's what I'd like to leave you with today. And I look forward to a rich discussion about some of these ideas at the Engage 21 conference. Thank you very much.